Hi, my name is Melissa Clark and welcome to the My Health Matters training. The aim of this training is to help you to understand how to use the My Health Matters book. It will also highlight the importance of working together for the benefit of our service users. So the My Health Matters book, this is Barnet's way of carrying out a health action planning for individuals with learning disabilities. So this was developed by the Barnet Nursing team and it was launched in November 2017, on the 1st of November. So this way of carrying out health action planning came into being because the previous health action plans, some of them were hard to update, and some of them weren't used consistently, and some of them had really long documents. So where did the health action plans come from? So to understand this fully, we'll have to just take you back a little bit and give you a bit of historical information. So the Valuing People 2001 government paper came into existence, and the aim of that paper was for people with learning disabilities to have access to mainstream health services. The paper recommended for health facilitators to support people with learning disabilities and that they should all be registered with a GP and have their own health action plan. The next point on the slide is the Healthcare for All 2008 report that highlighted health inequalities and recommended changes in terms of making sure that there are regular health checks carried out for individuals with learning disabilities and that there was closer working relationships between the health professionals. So this would result in an improvement in the overall quality of healthcare offered. It also suggested implementing a health action plan. The next point on the slide is the Health and Social Care Act 2012. This is a piece of law that requires health services to make reasonable adjustments for people with learning disabilities, which is a legal requirement. Examples of reasonable adjustments could be longer appointments or easy read information provided to the individual. There is also the confidential inquiry into premature deaths for individuals with learning disabilities, so for short CPOD. Now this inquiry came into being because they realized that individuals with learning disabilities were still experiencing poor health care. So what they did was they came up with 18 recommendations. So the recommendations that apply to health action planning, there are 3 of them. So recommendation 2 was about annual auditing of reasonable adjustments and making sure that the best practices were shared with other agencies and organizations. The next recommendation that came about was recommendation 6, which is about standardization of annual health checks and a clear pathway between annual health checks and health action planning. The third recommendation was recommendation 7, and it was about making sure that people with learning disabilities had the same access to investigations and treatments like individuals who did not have a learning disability. So, and it also pointed out that, healthcare professionals need to recognize that it might take a little bit longer to carry out the training or the treatment with individuals with learning disabilities. So it's just to let them understand and be aware that, things are going to take a bit longer when dealing with individuals with learning disabilities, really. So health action plans, what are these really about? So health action plans should be person-centered, okay, and it should be a plan about the individual's health, okay? They should have fair access to healthcare and treatment. They should explain how to communicate to the individual, and it should also explain how the individual communicates as well. It should give information on how to stay healthy, and health professionals should comment on appointments that they've had with those individuals so that everybody understands what has happened. So why is the My Health Matters book important? It encourages multidisciplinary working, okay? And many people with learning disabilities have multiple healthcare professionals involved within their lives. Therefore, this book allows for better communication of health needs between the MDT. All professionals involved in the care of individuals are responsible for ensuring the My Health Matters book is kept up to date, so that health needs can be monitored and also help to inform care package reviews. So what is included in the My Health Matters book? So this book, it has 4 main sections. First section is about me, then you have communication, then physical and mental health, and then health appointments. About me section, this is where you fill in details about the individual, their personal details, GP details, diagnosis, allergies, and information on important people to that individual. What I've done, I've created some examples here just for you to understand. So the first page, about me, you'll need to make sure that you fill in the person's name, date of birth, NHS number, address, GP details, their diagnosis and their allergies. And it's important to fill in all the sections. The next page is about important people. So here it's just basic information that's required. So the person's name, their relationship to that individual, contact number, and also just for you to state when to contact that individual. Yeah, if it's in emergencies that person needs to be contacted. The second section, which is about communication, this is really important for all healthcare professionals because it provides some really valuable information. It also tells healthcare professionals, how the individual will communicate when they're happy, when they're sad or in pain. Yeah. So and it also tells them how to communicate with the individuals, how the individual will communicate rather to them, and also how they should communicate with the individual, and also about their understanding and their mental capacity act is also mentioned in there. It gives you a good sort of understanding of that. So examples that I've placed in here for communication. The first page is how I communicate. So I've filled in for an individual. So about my communication, you could write, I can speak 1 or 2 words at a time. How I show you that I'm happy, I will laugh and smile. Another one could be when the person's sad. It could be the case where I cry and sometimes will shout at others. If the person's in pain, it could be the case of where the individual is able to say the word pain, or if not, they might be able to rock back and forth, which should give you an indication that something is not right. And the same for if they're feeling poorly as well. It could be just the case where they're rocking back and forth. Yeah. So the next page is titled How to Communicate with Me. So the top half of it is about my understanding. So I could say, I understand things I'm familiar with. I'm able to understand better if I can see pictures, objects, or touch what is being discussed. So the second half of that talks about how you should communicate with me. So it could be, please show me what you need me to do. Or it could also be using Makotan, gestures, or pictures when communicating with that individual. And you could also mention in there if the person has a communication guidelines, just to please refer to my communication guidelines. So there are these pages that are called communication tools with the heading, and they can just help you to communicate with the person more effectively. So if you're talking about feelings, there's one there about feelings, and you can show the person the relevant picture or get them to show you the picture that applies to how they're feeling at that point. There's also a page for treatment. So if the person is being asked to go to the hospital to get a scan or an x-ray, then you can show the relevant picture so that they can try and understand what you're saying. For physical and mental health, that section, everything mentioned here on this page, there is a page specifically for that. Okay, so there's diabetes, eating and drinking, behavior, epilepsy, sleep, teeth. So it's really important that we covered all the main areas that would affect this clientele group. So I've put some examples that will be good for you to see. So eating and drinking as first example, it says about my eating and drinking. So it could be the case where I have difficulties with swallowing, I eat fork mashable foods, I drink thickened fluids. And then at the bottom it says action. So this is the planning, how you're going to help them to achieve what has been written above. Yeah. So please make sure that I'm sitting upright during meal times. Please see my eating and drinking guidelines before helping me to eat or drink. And then at the bottom you have a review date. I've just put 3 to 6 months as an example. The next page is on bladder and bowel. So I'm able to go to the toilet independently but need reminding. I sometimes have difficulty opening my bowel, especially during hot weather. So the planning that will go towards that could be making sure, to encourage the person to eat more fruits and vegetables, making sure that the bowel chart is completed daily, and also to help the person to drink at least 2 liters of fluid each day, and also, to make sure that you note that if the person hasn't opened their bowels in 3 days, that the relevant individual such as nurse or GP has been informed, and then to also do a review date as well. So the other 2 examples here are mobility and diabetes. In terms of mobility, the person might have a cerebral palsy and use the wheelchair, okay, to mobilize. They also might need help getting in and out of that wheelchair. So the action planning for that would be to make sure that the wheelchair is being serviced regularly, and also to monitor that person's mobility to see if it's deteriorating or not. Yeah, and then you have your review date as well. For diabetes, it could be the case where the person has type 1 diabetes and they take insulin 3 times a day. So, and then the blood glucose needs to be checked as well before meals. So the action planning could be where, you need them, the person might say, please help me to take my insulin on time, to have a healthy diet, to check and record my blood glucose on a daily basis. Okay, and it could also be, please check and follow my guidelines for diabetes management. And then again, you put a review date in as well. The other 2 examples here would be on behavior and mental health. So in terms of behavior, I can get upset sometimes and be physically aggressive when my routine is disrupted. I can also be verbally aggressive if I am supported by someone that I do not want to support me. So in terms of planning for this individual, you could sort of try and inform them in advance, okay, about changes that might be happening to their routine. And you can also please let them know in advance regarding who's going to be supporting them. And if they're not familiar with them, then that's the time to let them know who that individual is and just sort of give them a general background on that person. And then you have your review date, which will be ongoing. So you have the mental health example. Someone who could have depression and take fluoxetine once a day for the last 2 years or so. So it's just about knowing that person and also making sure that you put on there if the person is, when they're poorly, if it's a case where they tend to self-isolate when things are not going so good for them. So for action planning, it could be where, you need to monitor the person's mood and behavior and flag it up, as quickly as possible once you notice that, and also to make sure that the person is taking their medication on time and that the GP is reviewing that medication as well. So health appointments. This section has reasonable adjustments and feedback from health professionals. For the reasonable adjustments, I've placed 3 examples. So the first one is if you know you have a clientele that is anxious whenever it comes to having a blood test done, so you know you need to have a reasonable adjustment done because it will take longer for this person to have a blood test. So there, that page will also ask you, how do I do that? So it could be the case you will need to reassure that person on the day, during the procedure. And people who can help could be someone who knows that person really well, their support worker or key worker, or even the learning disability nurse. Another example is people with learning disabilities tend to have issues about going to the dentist. They find that very, very unsettling, some of them. So when we'll need to make sure that there's reasonable adjustments for them, it might be the case where they will have to be sedated. So you'll then have to consider the MCA and best interests as well. And for this, you can probably get somebody to support the individual who knows them very well in order to get the procedure done. So the final example is if someone is actually wheelchair bound, and so they'll definitely need reasonable adjustments to be made. And first of all, they'll need to be able to access the building, and they'll also need the extra time to get in and out of the room to see, say for example, the GP or so. Yeah, and they can be supported by support staff or health staff. So the other page on here under health appointments is about feedback from professionals. Yeah, it's not a big page, so it doesn't require a huge amount of information. It just needs your name, role, date, what happened, and the actions taken, really. So once the My Health Matters folder has been completed, yeah, it's now a confidential document, okay? So therefore the data protection rules apply, all right? So individuals who have capacity are responsible for keeping it safe. For individuals who do not have capacity, it's the responsibility of the care providers to make sure that this information is kept safe. If for some reason the document is lost, then it needs to be reported via an incident report, or you can contact duty for that. So hints and tips for completion. Anyone can complete this document. As long as you're working with the individual, there is a section for you to complete, okay? So support workers, family members can complete, as well as the professionals who are working in their own particular area just need to complete their own sections, okay? So while you're completing the document, it's important to keep the service user involved, okay? And we would like for the document to be kept up to date as much as possible. So if you need additional pages, please feel free to contact us. If for some reason a professional has forgotten to fill in the section, then carers or family members can, fill in the document, the section that was not filled in, by just putting general information. Just so that the next person who sees that individual will have an idea what took place, okay? This My Health Matters folder, it does not replace the hospital passport, okay? So it's important to take it with the individual to annual health checkup as well. That would come in really handy. And also it is a big document, so you can fill it in small chunks, okay? So how to access additional support. Feel free to contact Barnet Learning Disability Services through duty and the email would be bldsintegratedduty@barnet.gov.uk. Telephone number, of course, is 0208 359 6161. I want to thank you very much for listening. I do appreciate it. Thank you.